Are you taking your blood pressure medication at the most dangerous time? Your doctor handed you a prescription and gave you an instruction that sounded almost too simple. Take one tablet daily. So you followed that instruction. Perhaps you take your blood pressure medication every morning with breakfast. Perhaps you swallow it with your first cup of coffee. Perhaps you take it after dinner because that is the only time you remember. Or perhaps you recently moved it to bedtime after hearing that nighttime dosing protects the heart better. But here is what many adults over 60 are never properly told. The time you take your blood pressure medication and what you take it with can change the way that medication fits into your daily life. It may affect dizziness. It may affect nighttime urination. It may affect your risk of falling. It may affect whether you remember or miss the dose. And for certain medicines, food, drinks, supplements, or another medication may change the way your body responds. But the greatest danger is not automatically taking the pill in the morning, and it is not automatically taking it at night. The greatest danger is changing the schedule, doubling a missed dose, or combining the medicine with something else without understanding your exact prescription. My name is Dr. Nathon Fox, and today I am going to reveal 5 blood pressure medication timing mistakes that seniors make every day without realizing what those mistakes may be doing inside the body. One mistake may be hiding beside your morning coffee. Another can send you repeatedly to the bathroom at 2 o'clock in the morning, when one unsteady step may threaten your independence. Another involves a breakfast drink that can affect certain blood pressure medicines longer than many people realize. And number 1 is the mistake created by one of the most repeated claims on the internet, that every person with high blood pressure should take medication at bedtime. Stay with me until the end because the truth is more nuanced and much more useful than that headline. I will also give you 5 questions to ask your doctor or pharmacist before your next dose. Before we go any further, write your age in the comments and tell me this: morning dose or bedtime dose? Which one were you instructed to use? And have you ever missed a blood pressure pill and wondered whether to take it late, skip it, or take 2 the next day? Be honest. Millions of people have faced that exact moment. What you write may help another senior realize that they are not the only person who has felt confused. Now, before we begin, I need to make one thing absolutely clear. Do not change the timing or dose of your blood pressure medication because of this video. Do not move a morning dose to bedtime without asking. Do not move a bedtime dose to the morning without asking. Do not stop suddenly. Do not double a missed dose unless the healthcare professional managing your prescription specifically tells you to do so. Different blood pressure medicines work differently. The safest schedule for one medication may not be the safest schedule for another. This is not fear-based medicine. This is informed medicine. And informed medicine begins by understanding what your body is doing across a full 24-hour day. Your cardiovascular system does not operate on a flat line. Blood pressure rises and falls. It changes when you sleep. It changes when you wake. It changes when you walk, eat, worry, exercise, drink coffee, feel pain, become dehydrated, or stand up quickly. For many people, blood pressure becomes lower while sleeping. Then, in the early morning, the body prepares to wake. Stress hormones begin to rise. The nervous system becomes more active. The heart prepares for movement. Blood vessels respond. Blood pressure may rise during this period. This is often called the morning blood pressure surge. That morning rise is real. But here is where people become confused. The existence of a morning surge does not prove that every blood pressure pill should be taken at bedtime. It means that medication timing may deserve a personalized conversation. After 60, this conversation can become even more important. The kidneys may process medications differently. The liver may clear certain medicines more slowly. Blood vessels may become less flexible. Balance may become less reliable. A person may be taking 5, 8, or even 12 different prescriptions. And a medication schedule that caused no problem at age 45 may contribute to dizziness, weakness, nighttime urination, or falls at age 75. So let us begin with timing mistake number 5. Timing mistake number 5 is taking a beta blocker with your morning coffee without paying attention to what happens next. For millions of people, the morning routine is automatic. Wake up, make coffee, take the medication, drink the coffee, eat breakfast. The entire process may happen within 10 minutes. Coffee feels harmless because it is familiar. But caffeine stimulates the nervous system. It may temporarily raise blood pressure. It may increase alertness. It may make the heartbeat feel faster or stronger. And in some people, especially those sensitive to caffeine, it can contribute to shakiness, anxiety, or palpitations. Now consider beta blockers. Examples include metoprolol, atenolol, bisoprolol, propranolol, and carvedilol. Depending on why they are prescribed, beta blockers may slow the heart rate, reduce the force of contraction, or reduce the effect of certain stress signals on the heart. Think of the nervous system as an accelerator. Caffeine may press that accelerator. A beta blocker is being used to reduce some of that stimulation. This does not mean coffee cancels the medicine. It does not mean every person taking a beta blocker must give up caffeine. And it does not mean there is one exact waiting period that applies to every patient. But it does mean that your morning pattern matters. Imagine a 68-year-old woman named Margaret. Margaret is a composite example, but her routine is extremely common. She has taken metoprolol for 3 years. Every morning at 7:15, she swallows her tablet. At 7:20, she drinks a large cup of strong coffee. At 8 o'clock, she sometimes feels a flutter in her chest. She assumes it is anxiety. She drinks another cup because she did not sleep well. The flutter becomes stronger. Margaret never tells her doctor because the sensation disappears before lunch. But the question she should be asking is not simply, is coffee bad? The better question is the amount or timing of my caffeine contributing to the symptoms I experience after taking my medication? Palpitations can have many causes. They may come from caffeine. They may come from dehydration. They may come from anxiety, thyroid problems, anemia, an abnormal heart rhythm, another medicine, or something unrelated to the beta blocker. The goal is not to diagnose yourself. The goal is to recognize the pattern. Write down the time you take the medication. Write down the amount of coffee you drink. Write down when the palpitations begin and how long they last. Notice whether they also occur on mornings when you drink less caffeine. Then bring that information to your doctor or pharmacist. If your label says to take the medication with food, follow that instruction. Use water to swallow the pill rather than coffee. Be especially careful with energy drinks, concentrated caffeine products, and multiple large cups. And never reduce or skip a beta blocker because you want to drink more coffee. Some beta blockers should not be stopped suddenly. That decision belongs with the professional managing your treatment. The practical action is simple. Ask, could caffeine be contributing to my symptoms? And should I separate it from this exact medication? Notice that I said this exact medication. Not every beta blocker, not every blood pressure pill. Your exact medication, dose, symptoms, and health history. Now we move to timing mistake number 4. Timing mistake number 4 is believing that grapefruit only matters when you consume it at the same moment as the pill. Many patients have heard that grapefruit can interact with medicine, but they imagine the warning means this: do not wash the tablet down with grapefruit juice. So they take the pill with water and drink grapefruit juice later. Or they drink the juice the day before and assume it no longer matters. But grapefruit can affect enzymes involved in processing certain medicines. For some drugs, this can increase the amount of medication entering the bloodstream. That may make side effects more likely. Certain calcium channel blockers are especially important in this conversation. These include medicines such as amlodipine and nifedipine. Amlodipine may also be affected, especially with larger amounts of grapefruit or grapefruit juice, although the size of the effect can vary. That is why the correct approach is not to make a universal assumption. The correct approach is to check your exact medicine. Think of the digestive system as having a security checkpoint. That checkpoint helps control how much of certain drugs reaches the bloodstream. Compounds in grapefruit can interfere with part of that checkpoint. When this happens, the medicine may not be processed in the usual way. The result may be a stronger effect than expected. For a blood pressure medication, that could mean increased dizziness, flushing, headaches, weakness, or low blood pressure. Now imagine a 72-year-old man named Robert. Robert has taken amlodipine for 2 years. His blood pressure has been stable. One week, his wife buys a new juice. The front of the bottle says, "Tropical Citrus Blend." There are pictures of oranges and mangoes on the label. Robert never turns the bottle around. The blend contains grapefruit. He drinks a large glass every morning. A few days later, he begins feeling dizzy when he stands from the breakfast table. One morning, he has to grab the chair to keep from falling. Was grapefruit definitely the cause? That cannot be concluded from the story alone. Dehydration, illness, other medicines, or changes in blood pressure may also cause dizziness. But the grapefruit ingredient is an important clue that deserves review. This is why reading the back label matters. A drink does not need to say grapefruit juice in large letters on the front to contain grapefruit. It may be hidden inside a citrus blend. And do not assume that a supplement or natural product is automatically safer. Natural products can still alter the effects of medicine. If you take amlodipine or another calcium channel blocker, ask your pharmacist, does grapefruit interact with my exact medication, and should I avoid it completely? Show them the bottle. Mention the dose. Also mention all other medications because grapefruit interactions are not limited to blood pressure treatment. If you develop severe dizziness, fainting, weakness, or unusually low readings, seek appropriate medical advice. Do not simply stop the medicine and wait. And unless your prescription requires something else, plain water remains the simplest drink for swallowing a tablet. Now we come to timing mistake number 3. This mistake does not initially look like a medication emergency. It looks like a bathroom trip. It looks like poor sleep. It looks like something people dismiss as an ordinary part of getting older. But in the wrong circumstances, it may contribute to a life-changing fall. Timing mistake number 3 is taking a diuretic too late in the day. Diuretics are often called water pills. Examples include furosemide, hydrochlorothiazide, chlorthalidone, bumetanide, and indapamide. These medicines help the kidneys remove additional sodium and water through urine. Less excess fluid may mean less pressure inside the circulation. Think of a garden hose filled with too much water. Reducing the volume reduces pressure on the walls. But there is an obvious consequence. If the medicine causes more urination, the time you take it influences when you need the bathroom. Many diuretics are commonly taken in the morning. Some people who need 2 daily doses take the second around lunchtime or earlier in the afternoon. But many patients receive a label that simply says, "Take once daily." No one explains what time. So they take it with dinner because that is when all their other pills are sitting on the table. Now picture Patricia, a 75-year-old woman living alone. She takes hydrochlorothiazide at 7 o'clock every evening. By midnight, she needs the bathroom. Then again at 2 o'clock, then again at 4:30. Every time she rises from bed quickly. Her blood pressure briefly falls when she stands. She feels lightheaded. The room is dark. Her glasses are on the bedside table. A loose rug sits in the hallway. Her walking shoes are downstairs. This is not just an inconvenience. It is a chain of risk. Medication timing leads to nighttime urination. Nighttime urination leads to interrupted sleep. Interrupted sleep leads to grogginess. Standing quickly may cause dizziness. Darkness reduces vision. And one misplaced foot may lead to a fall. For an older adult, a fall can mean a wrist fracture, a head injury, a hip fracture, hospitalization, rehabilitation, or loss of independence. The medication may still be appropriate. The dose may still be appropriate. The problem may simply be that the schedule was never clearly discussed. If you take a diuretic late and repeatedly wake to urinate, ask your doctor or pharmacist whether an earlier schedule is appropriate. Do not move it automatically. Some patients take these medicines for heart failure, kidney problems, liver disease, swelling, or other conditions that require a personalized plan. Ask what time the first dose should be taken. If you take 2 doses, ask how late the second dose should be. Ask what to do when you travel or will not have easy bathroom access. Also reduce hazards in the home. Use a nightlight. Remove loose rugs. Keep glasses and a walking aid nearby. Sit on the edge of the bed briefly before standing. Stand slowly. These steps do not replace medication guidance, but they can reduce risk. There is another dangerous assumption connected to diuretics. Some people hear that water pills reduce potassium and immediately begin eating large amounts of bananas, using potassium salt, or taking supplements. Do not do this without guidance. Different diuretics affect potassium differently. Some may lower it, others may raise it. Your kidney function also matters. The correct decision depends on your medication and blood test results. Never add potassium tablets or potassium-based salt substitutes simply because someone online said all water pills remove potassium. Now we arrive at timing mistake number 2. You have probably done some version of this. You forget your morning tablet. At lunchtime you remember. Or you remember while eating dinner. Or you see the untouched pill in the organizer just before going to bed. And immediately, your mind begins to negotiate. Should I take it now? Should I wait until tomorrow? Should I take 2 tomorrow to catch up? This is the moment when one forgotten dose can become a second mistake. Timing mistake number 2 is doubling a dose or taking doses too close together after forgetting the first one. The instructions for a missed dose are not identical for every blood pressure medication. For many medicines, the guidance is to take the dose when remembered unless it is close to the next scheduled dose. If the next dose is near, the missed dose is usually skipped. But the exact instructions depend on the medicine. Amlodipine instructions may not be identical to metoprolol instructions. A once-daily tablet may not have the same instructions as a twice-daily tablet. A long-acting medication may be managed differently from a short-acting medication. This is why you should not apply one rule to every bottle in the cabinet. Imagine a 66-year-old man named Dennis. Dennis works irregular hours. One Monday, he forgets his morning pills. At 10 o'clock that night, he sees the untouched compartment. He takes the missed medication. The next morning, half asleep, he takes the regular dose at 7 o'clock. Now the doses are much closer together than intended. Several hours later, he becomes weak. He stands and nearly faints. Was this guaranteed to happen? No. But taking additional medicine too close together can increase the risk of low blood pressure, dizziness, a slow heart rate, weakness, or falls, depending on the medication. The safest solution is to know the missed dose plan before you miss anything. Ask your pharmacist, "What exactly should I do if I forget this tablet?" Write the answer down. Place it near the medicine. Do not trust yourself to remember complicated instructions when you are tired or worried. Use a pill organizer that clearly shows whether the dose has been taken. Set a phone alarm with the medication name. Connect the dose to a reliable daily habit. Keep a written medication record if you take many prescriptions. And if you cannot remember whether you already took the pill, do not automatically take another one. Check the organizer. Check the record. Ask the person who helps with your medication. Call the pharmacist if you are unsure. Uncertainty should lead to verification, not another tablet. Also remember that some medications should not be stopped suddenly. Beta blockers and certain other drugs may cause problems if abruptly discontinued. So repeated missed doses are not simply an issue of forgetfulness. They may affect blood pressure control and, depending on the drug, create other symptoms. Tell your healthcare professional if missed doses are frequent. There may be a simpler schedule, packaging system, or medication plan that is easier to follow. And now we have reached timing mistake number 1. This is the one I want you to hear carefully, because this mistake often begins with a confident headline: "Never take your blood pressure medication in the morning," or "Taking blood pressure pills at bedtime cuts your heart risk almost in half." That sounds powerful, it sounds scientific, and it sounds like something you should act on immediately. But medicine becomes dangerous when one study is turned into a universal command. Timing mistake number 1 is believing that bedtime dosing is automatically better for every person taking blood pressure medication. Earlier research created major excitement about taking blood pressure medicine at night. One influential study suggested very large reductions in cardiovascular problems among people assigned to bedtime treatment. The idea seemed logical. Blood pressure often rises in the morning. If medication is strongest during that period, perhaps it can offer greater protection. But important questions were raised about the earlier research. And later, a large independent trial called the Time study compared morning and evening dosing of usual blood pressure medicines. It did not find a meaningful difference in major cardiovascular outcomes between the two schedules. Some patients experience a normal reduction in blood pressure during sleep. Others do not. These people may be described as non-dippers. Some patients may experience pressure that falls too low at night. Others may have high morning readings despite apparently good office readings. A 24-hour ambulatory blood pressure monitor can sometimes help reveal these patterns. This device measures pressure during the day and night. Instead of showing one reading in the clinic, it shows a full pattern. Imagine Eleanor, age 79. She has taken lisinopril every morning for years. Her office readings seem acceptable. But at home, she occasionally sees high numbers shortly after waking. She watches a video claiming that morning dosing is dangerous. That night, she moves the medication to bedtime without telling her doctor. At 2 o'clock in the morning, she gets up to use the bathroom. She becomes lightheaded. She reaches for the wall. She does not fall, but the experience frightens her. Was bedtime dosing necessarily wrong for Eleanor? Not automatically. Was morning dosing automatically right? Not automatically. The mistake was changing a long-standing treatment schedule without reviewing her overnight pressure, symptoms, fall risk, other medicines, kidney function, and the reason lisinopril was prescribed. N. But they may also investigate sleep apnea, excess sodium, alcohol, pain, stress, missed doses, inadequate medication duration, or another health condition. The correct answer could be a timing change. It could be a dose adjustment. It could be a different medicine. It could be a 24-hour monitor. It could be treatment for another condition. The point is not that bedtime is bad. The point is that bedtime is not automatically best. The best time is the time that fits the medication, the patient's blood pressure pattern, the side effect pattern, and the daily routine. Consistency often matters more than chasing a dramatic headline. If you regularly forget a morning pill but never forget your evening routine, that is useful information for your doctor. If bedtime dosing makes you dizzy when standing at night, that is also useful information. If a diuretic destroys your sleep, the timing deserves review. If a medicine makes you tired during the day, another schedule may be considered. But every change should be made with professional guidance. Now I want to give you the 5 questions that may protect you from all 5 timing mistakes. Question number 1. Does the time I take this exact medication matter? Show your doctor or pharmacist the bottle. Do not ask only about blood pressure medicine. Give the exact name, dose, and whether it is extended release or immediate release. Question number 2. Could the timing be contributing to my dizziness, fatigue, swelling, nighttime urination, poor sleep, or palpitations? Symptoms often reveal more than one isolated blood pressure number. Question number 3. What should I do if I miss a dose? Ask for exact instructions. Write them down. Do not wait until the mistake happens. Question number 4. Are there foods, drinks, supplements, or over-the-counter medicines I should avoid or separate from this prescription? Mention grapefruit. Mention coffee and energy drinks. Mention alcohol. Mention ibuprofen and naproxen. Mention vitamins, herbal products, electrolyte powders, and salt substitutes. Question number 5. Would home blood pressure readings or a 24-hour monitor help determine the best schedule for me? That question shifts the conversation away from internet headlines and toward your actual body. Now let us bring the 5 mistakes together. If you take a beta blocker and notice palpitations around coffee, record the pattern and ask about caffeine amount and timing. Do not stop the medication to test the theory yourself. If you take amlodipine or another calcium channel blocker, ask specifically about grapefruit. Read every citrus blend label. If you take a diuretic, ask whether earlier dosing may reduce nighttime urination. Do not automatically supplement potassium. If you miss a dose, follow the instructions for that specific medicine. Do not double automatically. And do not move a blood pressure medication from morning to bedtime or bedtime to morning because one online video told you there is one perfect time for everyone. There is one more truth I want you to carry with you. Taking blood pressure medicine does not mean you failed. High blood pressure can be influenced by age, genetics, kidney function, artery stiffness, weight, sleep, sodium intake, alcohol, smoking, diabetes, stress, activity, and many other factors. Medication is a tool. It may help protect your heart. It may reduce stroke risk. It may reduce stress on the kidneys and blood vessels. The goal of this conversation is not to make you afraid of that tool. The goal is to help you use it safely. Because how you use a tool matters. A correct medicine taken inconsistently may not provide the intended protection. A correct medicine doubled after a missed dose may create side effects. A correct medicine taken at the wrong time for your routine may repeatedly disturb sleep or increase fall risk. And a useful medicine combined with an interacting product may behave differently than expected. Information is not separate from treatment. Information is part of treatment. Keep a current medication list. Include prescriptions, over-the-counter products, vitamins, and supplements. Bring that list to appointments. Use one pharmacy when possible so the pharmacist can review interactions. Record home blood pressure readings, but do more than write the numbers. Write the time. Write when you took the medicine. Write whether you had coffee. Write whether you had been sitting quietly. Write whether you felt dizzy. Write whether you slept poorly. Write whether you were in pain or under stress. That context can turn random numbers into a meaningful pattern. One high number is not always an emergency. One low number is not always proof that the medicine is wrong. One episode of dizziness does not establish the cause. Patterns deserve decisions. Isolated moments deserve observation and appropriate medical advice. Before this video ends, think about your medication routine. Do you know the name of each tablet? Do you know why you take it? Do you know whether it should be taken with food? Do you know whether grapefruit matters? Do you know whether it increases urination? Do you know what to do if you forget it? Do you know whether it can be stopped suddenly? Do you know whom to call if the reading is unusually high or low? If you answered no to any of those questions, you have not failed. It simply means a conversation still needs to happen. Write the questions down. Call your pharmacist. Bring them to your next appointment. Do not wait for a fall, fainting episode, double dose, or severe interaction before learning how the medicine should be used. Now I want to hear from you. Which of these 5 timing mistakes surprised you most? Was it the morning coffee pattern? The grapefruit warning? The late water pill? The missed dose mistake? Or the truth that there is no single best time for every person? Write your age and your medication schedule in the comments. Morning or night? And what were you told to do if you miss a dose? Your experience may help the next senior ask a question they did not know they needed to ask. This is Dr. Nathon Fox. Take your medicine exactly as prescribed. Never change the timing or dose without professional guidance. And remember this, the most dangerous time to take your blood pressure medication is not automatically morning or night. It is the time chosen without understanding the medicine, the instructions, the symptoms, and the body it is working inside.